Out of the largest 100 counties in the country, Miami-Dade has the third highest share of uninsured working age adults. That's nearly about 40%. Really an amazing statistic. Now, needless to say, healthcare is an important issue to all of our families. The Supreme Court ruling this week on the so-called Obamacare has certainly heightened the awareness from everyone. We can all agree that families should have affordable, quality health care that's available to them, like is currently available at Jackson. Now, there's been much press about Jackson and the challenges that this medical institution has been experiencing. And it's a very complicated set of issues, we know that. And so, but I think in our communities, we're sick and tired of having things be so complicated that nobody bothers explaining anything to us. So at some point, the complication has to be, somebody has to take the lead in simplifying this alleged complication. So I'm going to ask you to take a shot at it. And I realize that this is maybe a little more difficult than maybe people would even know. What, in your opinion, is the single biggest challenge at Jackson? And again, understanding that these issues are very complex, what is the single most important action you believe should be taken to steer Jackson back to good health?
I've offered several times that it go back and become a department of the county to maintain Jackson's viability, maintain Jackson's funding, and not privatize it. They are working towards a conclusion of privatizing the institution, and I'm not in favor of that. I think it should be a public hospital, but as a public hospital, not under a trust, it should be a department of the county. We've seen what the trust has done, these quasi-independent authorities, and they've not managed our dollars correctly. They don't account to anybody. They're either elected, and the way they're appointed is basically a rubber stamp, a slate that you're given. I proposed on several occasions that it be a department of the county.
What is it now?
It's a quasi private authority, in my opinion.
Well, that clears it up. A hospital is under your purview as county commission, right? There are strings directly attached from the hospital to the county, even though it's not a department. Is that correct?
Very minor strings to the county commission when they go to buy certain large assets or dispose of certain large assets. Then they come to us. But the day-to-day administration, the day-to-day, all the boards, those are all.
Do you have approval over the budget at Jackson?
We see the budget as a totality. We do not approve the individual budget line item by line item.
That's very helpful. Thank you. No, it is. For me, it is.
I was fire chief of the City of Miami Beach Fire Department. At that time, I used to manage 25% of the city budget. Always were on time. Always were, under the budget. When you look at the and the budget is presented to these good folks right here as line items, you need to know what they're presenting you, and that's what's happening. They don't know what is being presented to them, because when you have a line that, for instance, you must say toppers. Toppers is a piece of equipment. Okay, you don't know what that is. Well, guess what happens? Down the line, when you start running short of money, they do a change of line, and they funnel that money to someplace else. People on the commission right now don't know how to do that, and I think that's the number one problem that we have.
So you're saying you want to hold the county budget of Jackson accountable for line items?
Correct.
So that line items can't be
correct. Let me give you an example.
Just want to make sure I understand.
Jackson can award anything under $100,000 without a bid. Subsequently, they were bidding out lobbying positions at Jackson, and they were charging $96,000. That way they didn't have to go in front of the city commission. and I can give you names, and these names are very politically involved. Okay? So, I trained at Jackson, I was a paramedic, and I know how important Jackson is for us. And one of the big problems that Jackson has had is that the board has been staffed by political hacks, people that did favors. We need to allow the employees to have participation with their input to make the institution run better. And yes, it needs to be under county control.
I mean, please, there is a concept that, you know, maybe because I am an outsider, but to me, I see government usually, they talk about the items in a budget because they don't make money. They have many of the people sitting there, they have never made a dollar in their life. They don't know the concept of creating a budget and how money flows. So basically, most
15 seconds.
Okay, most politicians, basically, they know how to spend your money, but they don't know how to make it. And when they run out of money, they ask you for more money by raising your taxes.
I think one of the main problems facing Jackson today is this relationship between the University of Miami and Jackson. Before, it was a wonderful relationship, but the moment that the University of Miami purchased their own hospital across the street, we became competitors instead of actually being partners. One of the other issues, I think, facing Jackson is the Financial Recovery Board and the Public Health Trust that we've had in the past. Because of both having the oversight for Jackson, it really leaves Jackson much more vulnerable in terms of those interests who really want to take money away from Jackson. One of the things that I'd like to see happen is what Commissioner Barrero recommended. I'd like to see it come back to the Board of County Commissioners. You know, they keep complaining that the commission interferes, but if you look at the number of times that the commission has interfered with Jackson, it's been when they wanted to close Jackson North and Jackson South and wanted to close the OB unit. And the commission would not allow it to happen. You can count the number of times on one hand in the last 5 or 10 years. So I think the commission would have, Jackson was developed to be a public hospital, a single standard of care regardless of your ability to pay. We need to keep it that way.
Jackson didn't get into financial difficulty just over the last year, the last couple of years. It has been going on for a long time, and I do want us to remember that prior to the bottom falling out, it had problems, and the Board of County Commission was making appointments to the governing board of that hospital, and some of them actually sat on that committee. So there has always been direct intervention, supposedly, and oversight. But I would say that to save Jackson and to get it on much sounder footing, we need look no further than Broward County. They have one of the most excellent managed healthcare systems for that whole county that we can take note of. If you don't know what you're doing, go to someone who does. And Broward County does an excellent job there. You don't hear them in the news about mismanagement. You're not having all these problems with their unions. And I do say to the unions, this is an excellent opportunity for you to move from stating what the problem is to stating and being a part of the solution. Your members work there. I believe that they have some good ideas, and you need to make sure that they're at the table. And there's a venue for them to be able to give their ideas. And when it comes to sacrifice, everyone is going to have to sacrifice. And I believe the union's in a great place to begin to have that happen. I would encourage them to start doing it.
Jackson needs to become a county department. We have tried the Public Health Trust, now we have a Financial Recovery Board, and this commission, we have stayed out since I've been there, except for the 3 occasions that Commissioner Jordan has mentioned. We've stayed out of the governing process, and that's because that is the way that it was written. University of Miami, yes, that was a good partnership at one point in time. But after they purchased Cedars, then yes, they began to compete against Jackson, and the doctors began to send the clients over to UM instead of keeping them over at JMH, where they should have been and where they originally came. We also need to start an aggressive campaign to bring in more insured patients to Jackson to help pay for some of the costs. But Jackson was started for the indigent and the poor. So therefore, it's going to be very difficult for Jackson to stay out of the red anyhow because of the way it's been set up. We need to go right in there and change the way in which Jackson has been operating. And that's what I'm looking to do, and I'm still trying to find a way. So don't ask me what is the way, because I'm still trying to find that way, and I think a lot of us still in the community are trying to find a way to do that. But the whole structure needs to be changed.
It's critically important that we have a public hospital in Miami-Dade County. Where I work in Liberty City, there are a lot of families who are hurting. To not have a facility that can honor these people's needs would be a travesty in this community. And no, there is no easy answer, and I don't have an answer either, but I do believe there are examples all over this country, Broward County included, where public hospitals work. So we have to be big enough to recognize that we have something to learn from others and bother to take the time to understand what is working in other places and how we can apply those things in Miami-Dade County. If we continue to do the wrong thing and expect different results, that's the definition for insanity. And as we continue to operate that way, people continue to be sick. There are people who work in these hospitals who are losing their jobs. And the way we are currently operating our business is making the community and the staff there sicker than the people who they should be serving. I think we have a responsibility to look at examples of where public hospitals work through coalition building and do what's right for this community.
The first place that we look to solve Jackson's issues are the people of Jackson. There has continuously been demonstrations where you have doctors, nurses, janitors. You have many people from different aspects of the hospital that are standing up and saying not only don't privatize Jackson, but this is how we keep it. This is how we put it in the black. I mean, it doesn't take a rocket scientist to understand that when your expenditures are higher than your revenues, then you have a negative effect, a deficit. And so what we have to do, what Jackson did, was they laid off thousands of people. Because someone said, well, if we drop the expenditures, then we might make a profit. But the expenditures weren't toilet paper. There were people. There were people who had to pay house bills, who probably will have their homes foreclosed on. There were people who put their children through college. There are people who have been in this community for a very long time, and they're let go. They're gone. And so what we have to do is look at the other side, the revenues. Part of the problem with Jackson Memorial Hospital is the revenue stream. Is the hospital reaching out? Is the hospital reaching out and saying, we need to build these people that came in for services? Are they actively engaged in trying to get the money that's due to them? The same way when they call our phones in the middle of the night during dinner and ask for their money for college tuition. Same way, we need to do that at Jackson.